Hi, my name is Adria Sullivan, and I am the founder of Cognitive Clarity. I'm a mental wellness coach and licensed mental health therapist. And my specialty is psychedelic assisted therapy. So today I'm going to be sharing all the information on ketamine assisted therapy. That is a question I get every day because it is legal all over the United States. And it's something that people are reaching out to because they're finally realizing that there could be an actual answer for healing, for true healing, not just taking a pill for the rest of your life and relying on that. So that sounds enticing. That's exactly why I chose to get into psychedelic medicine. I do believe that these are true medicines, not drugs. And if you are at a point where you're looking at them as drugs still, then let's first talk about that. I think that before you would ever start to engage in psychedelics as medicine, you should be fully informed, be fully comfortable, and just know your stuff because psychedelics are not for everyone, but they have truly been shown to help people heal on such a deep level mind, body, spirit healing. All right, so now I'm going to talk about ketamine specifically. Ketamine, it was approved decades ago as an anesthetic by the FDA. It is a dissociative. So, unlike your traditional psychedelics that you might think of, like LSD, psilocybin, where you're going to have a lot of visuals, well, you may have a lot of visuals. I'm sure you've heard stories of psychedelics and what they do to someone, but ketamine, in the sense of therapy, is a much lower dose than I'm assuming people are taking at festivals where they're fearful of getting into this K hole. Um, the dissociative aspect of this doesn't always happen every time, but that just means that you kind of have this out of body experience that maybe you feel like you're floating away from your body. You, to me, I would describe it as more of like a dream-like state versus necessarily seeing visuals or anything like that. It is Ketamine is frequently used even on children in hospital settings. So I believe this is a very, very safe drug to me, and in anyone's opinion that is in psychedelic medicine. This is way safer than giving our kids Adderall or any of these drugs that really hype them up. And I am not against psychotropic medication, but I do believe that sometimes we are overprescribed. We're given these medications forever, and that shouldn't be the case. So, the good thing about psychedelic medicine is that it is not intended for long term. It is intended to give you this medication and heal you from what's going on. All right. So back to the information on ketamine. In the early 1990s, Yale researchers conducted a single dose study of ketamine on 9 patients to see how depressed people would react. They noticed that chronically depressed patients experienced almost immediate relief. Those results were published in 2000. With further studies, they have found evidence for conditions treatable with ketamine to include severe or chronic depression, postpartum depression, suicidal thoughts, bipolar disorder, PTSD, OCD, and some substance use disorders. Now, I want to pause right there to say that with all of those diagnoses, if you're coming to treatment, there, and I'm going to go through all the different routes of administration, but based on your diagnosis, there could be a different recommended route of administration because of the amount that you might need to be given, because of other contraindicators that go along with the diagnosis that you have. So that's why it's really important to get your information and make sure that you are not just consulting with someone that has done psychedelics. make sure you're consulting with somebody that is a certified psychedelic assisted therapist, a psychiatrist, or a doctor that is also certified in psychedelics. If they're not, hear what they have to say, but go to somebody that has been, because of the wealth of misinformation out there, right? And we're still recovering from the war on drugs. And now we have been liberated from that in many ways. We still have a long way to go. But because of that, our generation, we grew up believing that these medicines are going to put holes in your brain and you're going to be so addicted. Let me tell you, there is no one in rehab that is there for psychedelics. No one. Look it up, call around. So the pushback that I often get is, are you getting people addicted to drugs? No, I'm not. Oftentimes, when people go through ketamine assisted therapy or psilocybin therapy, they're ready to be their very best self. They want to be so healthy. And they often stop drinking alcohol, or they stop smoking, or they start working out. And so, no, like, we don't really replace those things. And psychedelics aren't something that you want to do every day. It's truly an experience, and when done right, a very healing experience. So psychedelic medicine is different from other psychotropic medications such as like Zoloft, Adderall, any SSRIs for depression and anxiety, because it's very fast acting. It's shown to relieve symptoms in people who are resistant to other medications. It can actually relieve suicidal thoughts immediately. So if you are suicidal and you go into the ER, chances are you're going to get a shot of ketamine because it takes it away. It has very minimal side effects. Now, there are those with contraindicators that I will talk about in a later video. They, again, are not intended for long-term use, and they have a 70 to 80% response rate, right? Like, that's amazing. I know so many of you are feeling defeated and stuck because you have tried everything. Well, if you haven't tried this along with therapy, then this might be your opportunity to truly heal and overcome what has just really kept you down, because that's not the life you're supposed to be living. All right, I'm going to go next and talk about the routes of administration and where you would go to find that. All right, thank you. All right, so we're going to go over the routes of administration for ketamine specifically. Now, these are not in any specific order of what is better and what is not. If you give me a call and we get on a chat and you tell me what you're experiencing, what your diagnosis is, what your goals are, I will recommend one of these routes of administration. And sometimes people qualify for all of them. And then I would talk to you about the specific experiences of those. And then you get to decide what's best for you. So the first one that I'll talk about is intramuscular. So that's getting a shot in your arm. That has to be provided by a nurse in a clinic. And the benefits to that is it is really quick delivery. So within minutes, you are transported into your experience. The first time that I ever tried ketamine, it was with a shot, and it was like where I was sitting in the chair and it felt like I was just like, whoosh. And it was an amazing experience, but it was a very intense experience. And I did it with therapists. This was in my training. So I had a therapist right by my side that I was able to reach out to, ask for a hand. I was able to talk through my experiences as they came. And so with the intramuscular, you have a much higher intensity of the medication, as well as the next one we'll talk about. And of course, it can always depend on the person, but because it kind of goes up in you so fast, it also comes out fairly quickly too. So I would say, in my experience, in about an hour, you've been given the medication and you're good to go. Um, the next one is an IV. So, an IV also has to be administered by a nurse in a clinic type setting. And the IV is good because they're actually able to titrate the dose as needed. So, it's not as quick of an onset, but they could add more if you needed more, or stop adding it, and as they take it away, like, your experience and goes away. um so it's just a slightly longer onset than getting a shot. It's slightly less intense, and its effects tend to wear off about 10 to 30 minutes after the end of the infusion. It is recommended that clients have 6 to 8 infusions over the course of 3 to 4 weeks, and then maybe a booster every 4 to 6 weeks after that. All right, both of those routes of administration are recommended for clients who might have any type of medical complication, because that way there is a nurse on staff. Often there's a doctor there as well. You're in a clinical setting, so they can handle any possible side effects. Um, you may find therapists out there that will take you on. I won't. As a client in my office solo, I won't do that. But I will, and I do accompany my clients to a clinic, because oftentimes, especially around here, I'm in North Carolina, um, there aren't a lot of clinics that have trained certified psychedelic therapists right there with their clients. Oftentimes, you're going to find that they are relying on the the medical model that says medicines are your answer. And so, at the clinics I've been to, they will give you a shot. And now with the IV, they are more likely to check on you because they're doing the titrating. But with the IV or IM and in a clinic setting, it's often just you're given the medicine and then you have the experience and then you leave. There's no talking about it. There's nobody writing down for you everything that you experienced. There's often no hand holding because they're not in there to know that you need a hand. So I don't agree with that. And that to me is leaving people open to further traumas, for a scary experience. And, you know, stories that you may have heard might be that these are like bad trips. The good part at the same time is that when you're given a shot or an IV, it is such a more intense experience that for that peak experience, often you're very internal. So you're not necessarily processing through like you would be doing it like in a regular counseling session. But I go so far above and beyond for my clients that I create a whole experience that it's the medicine is part of it, but we start with meditation and grounding and intention setting. And then they go through their experience, and then I'm there as they start to come to, and I'm there to jot down everything that they experienced. And then later in our integration sessions, which happen between dosing sessions, then we're really like anchoring their experience in their life. So that way it goes beyond an experience, it's life changing and healing. So when when clients come and we do a chat, and if I do think that you should probably be in a clinic setting, I will refer you out to a clinic, hopefully one that will allow me to come in. But if you choose to go to a clinic, or maybe they do have somebody at a clinic where you are, then that's wonderful. And I'm always there for support, for integration, for any other questions that you might have. I don't ever want anyone to feel like, well, I do want that, and I'm just out of luck. Like, you're not. Just we'll build it in any way that we can. All right, the next route of administration is the intranasal. So there is one out on the market called Spravato. Spravato is the only ketamine that is covered by insurance at this time, the time that I'm making this video. I do not have experience with Spravato or the intranasal. Um, it is a route that you just sniff, and the good side of that is you have a little bit more control over the dosing if you do it right. You can start off a little slow, kind of let it sink in, and then you can give yourself a little bit more. But it does, kind of just take some finesse because you're squeezing and you're sniffing, and you're hoping that you're getting the right one. So this route, because it's the one that I have the least experience with, I don't really have much more to offer on that one. I have seen people have success with that. One of my good friends through my training program, that is what she offers in her office. And she's very skilled with that. So if anyone is really interested in that route, I have the perfect person here in North Carolina to refer you to. All right, the next one, and this is the one that I offer in my office. These are this is the oral route. So specifically, I use the rapidly dissolving tablets, or RDTs. And that to me is the best route for therapy. So now on your dosing days, we don't do like traditional therapy, because therapy is very much more interaction. Like I'm listening to you. I'm maybe guiding where we're going. On your dosing days, I am fully there to support you, comfort you, and just take care of your every need. Like I said, we do meditation and grounding and intention setting, and I'm there to hold your hand if you choose and you give consent. I'm there for you as you're coming out of it, to reassure you, to write down everything that you experienced. And then as you're coming out of it, we might do more talking. And the amazing thing with psychedelics is, if you think about when none of us escape trauma. So whether we have big trauma or little traumas, when that happens, our brains go into defense mode, and they kind of like think of it, they just create a barrier around that. And so, what it might come out as is like perfectionism, or the inability to connect emotionally with people that we love. So, they come out as that. But when you're under ketamine, the barriers are lowered. So you might have this experience where you're like, whoa, I didn't even remember that, or now it all makes sense. And so that's a very fragile moment or exciting moment, not fragile, but we can capture that and we document it. So that way, on our integration day, where you're not under the influence of any medication, then we're going to process through that, so that you're finally able to escape the barriers that sometimes we don't even know are there. And those are the ones that just keep tripping us up. We set a goal, we don't reach that goal, or maybe we write on motivation for a while, and then it gets hard, and then we give up, and we keep coming back and asking, why does this keep happening to me? Well, this is a lot of the times why. So a little bit more about the oral experience. The onset is about 10 to 30 minutes. So it's a slower onset, which is why, I have a lot of clients with anxiety, and the slow onset, for some of them, that's exactly what they're looking for. They don't want to be like transported really quick. Although transported really quick leaves you a lot less time to think about it. But that's why we do a lot of grounding and meditation. And so I've never had somebody that, freaks out during that time. We just know that it's taking a little while to settle in. It is lower intensity. So while some people are very internal and they're just internal processing the whole time, that's wonderful. Other people tell me everything that they're experiencing. So it's wonderful to have somebody there documenting it all. Because with ketamine, unlike some of the other psychedelics, um, you do run a chance of not really remembering some things, especially on the higher doses. You might remember right after, but it does tend to fade a little bit, which is why we really must do integration and anchoring our experiences into our life so that this truly is healing. This, let's see here. Um, this method has been shown to have a very low likelihood of adverse outcomes, but it is more dependent on external factors, such as how much food did you have that day? Now, the RDTs, they do stay in your mouth, so it actually absorbs through your mouth. But in 20 to 30 minutes, depending on the intensity of where you're at, how you've responded in the past, you may end up swallowing it, and then it becomes the S-ketamine in your body. And so your experience might be then a lot longer, a little bit more intense at that point. Um, and I do recommend that for most people, but not everybody. It really is client dependent. So don't go in with this mindset of like, this is what I should do. Take that out of your mind for any psychedelic therapy. Be true to yourself and listen to your body, listen to your heart and your trained therapist. Um, I do go through with my clients 2 pages of how to prep themselves that day. It's not hard, it's just something that you should know. All right, the next video is going to talk about contraindicators for psychedelic therapy because it is not for everyone. Thanks. All right, so psychedelic medicine. Wow. On one hand, I wish it could be for every single person in this world because I have this theory that if we all were able to do that and we all broke through our trauma and our setbacks and our barriers, then we would be fully thriving. We'd be walking every day in our God given potential. We'd be just up leveled. Can you just imagine a world where everyone actually heals themselves? Like that to me is amazing. However, there are other routes to healing. So psychedelics is not the one and all for everyone. But for some people, this is your answer. But I want to go through who I wouldn't accept as a client of mine because of my own limitations in the setting that I'm in, where I don't have a nurse on staff, I don't have a doctor on staff. And there are studies that, have just shown that they're not sure how it's going to pan out because, right, like there's fairly new research coming out all the time. So for now, and the day that I'm making this video, these are the contraindicators. So for clients with increased intracranial pressure, currently manic or psychotic, experiencing an exacerbation of cardiac disease, you have uncontrolled blood pressure. Uncontrolled blood pressure might be like if you have a systolic blood pressure of greater than 150 to 160. Especially for ketamine, ketamine does raise up your blood pressure. So if you're in a clinic, they will often they will take your blood pressure, they will check your oxygen levels before. So if anyone comes to me and you are even on blood pressure medication, I will ask that you consult with a clinic. If you've just been on blood pressure medication and it's totally controlled, I actually might have you talk to my prescriber first and let them clear you if there was really no other health concerns. So I wouldn't say that totally takes you off the table for me. But if you fall under any of those, then that doesn't mean you will not qualify for ketamine therapy. It just means that I'm going to recommend that you go to a clinic, and I am happy to assist you there if you choose a clinic that allows somebody else to come in. So all clients that reach out to me, if you schedule a call with me, we will just go over again, what's your diagnosis? What's your history with physical and mental well-being? Do you have you had extensive treatment? What forms of therapy have you engaged in, and um, what has been your progress so far? Are you actively suicidal, or have you been suicidal? Have you had any attempts? Do you have any history of psychosis? Do you have any medical risk at all associated with your heart, your liver, your kidneys, your esophagus? Um, if if we talk and it's not controlled, or at all don't feel comfortable doing it in my office, I will refer you to an appropriate place, and I will give you referrals. I will not just turn you away to find it on your own. So how let's see here. I do have lots of notes because there is so much information on this. um, all right, so the next video, now that we've done contraindicators, I'm just going to go through how I can best support my clients, and why I think my method of therapy is the way to go when it comes to truly wanting to heal and overcome what's been keeping you down. So let's say we chatted and I've given you the route of administration that I would recommend and you've chosen for yourself. So here's how I can best help. The first thing is, if you decide you want to go or you need to go to a clinic for assistance, I can actually, I'll really work with you. It's going to be client specific. But I can either come with you into the clinic for your dosing days, if allowed, if um, if the clinic allows, if you want to do that. The other things that we potentially could do is do a virtual session. I if you did that, I would recommend that you have someone in your life that can come with you. Um, Ketamine can make you really sensitive to light. Um, you may not really be able to come to a computer and turn me on to talk to you. So if you were able to have somebody else there, that'd be great. Or as soon as you get home, we could schedule the talk then. And if you had somebody coming with you, they could maybe write down everything you talk about, because I really find that that is vital. There's so many things that would be lost if nobody was there for you. And I would never want that. And I would never recommend anybody be left alone in anywhere doing any psychedelic. Um, so most clinics I have come in contact with, understandably, because that's been the way of the Western world, is they're running on a medical model. They, you know, fair actually, like, I think they try to offer a cozy room, but it's still like maybe an uncomfortable couch or chair, fluorescent lights. Um, we can talk about, and I'll help you try to design your room as much as you can to be very comforting. So I bring a lot of stuff with me when I'm supporting people in a clinic, and I just try to make it feel like you're loved and comforted and supported, because how you feel going into a psychedelic experience might often influence your experience. I do provide, like, let's say you're going to a clinic, I bring with me music that you can use, because the clinics I've gone to, they just give you the medicine. There's no eye shade, there's no music. You're just like you could hear people talking out in the hallway. So instead, put some earbuds in, put an eye mask on, get comfortable in a blanket or a weighted blanket. Um, Really, I do everything to help you really get internal. Um, they will take your blood pressure, they will check your oxygen levels, they will administer the medication, and they will do all the medical things. I am there to simply assist you and support you and guide you. So if going to a clinic, that is what I can provide. And if you choose to only get your medication through there and do therapy with me in between or coaching with me in between, I'm up for that as well. And that way I can also kind of coach you on how to support yourself as much as possible. Because I do also have a lot of clients that are out of state, that I'm providing psychedelic coaching to, and I can't be there. So we've found a workaround. And of course, it does depend on the type of client. If I feel like you need someone there with you, I'm probably going to help you find somebody that is local to you for you to go see. All right. So I view psychedelics just like I view other psychotropic medications in terms of they are only half of the answer. To get the most therapeutic benefit, we must not only focus on the medication, but we really have to fill it in with processing and going through all of the stuff that comes up. Um, you, I really want my clients and anyone I talk to approach this as this is the step that I'm taking to propel my mental wellness, that there are other aspects that I need to keep in mind, such as wellness on my physical level, wellness um, in my ability to stay present, how I show up for my family. A lot of times we're integrating your experiences, and then you go back to a world that views you the same as you were before. And that can be hard sometimes. So know that those that this is my belief, and I know it's a shared belief amongst certified psychedelic therapists, is that those that just go get the medication, you're oftentimes going to be left with very similar outcomes as you were if you just took a medication. So I myself do not take on clients that are not ready to do the work. And even if that's slow progress, that's okay. But I want to work with people that are truly ready to make a change in their life, because I'm a holistic therapist. I work with you on mind, body, spirit type stuff, right? I'm interested in what you're eating. I'm interested in how you're moving your body. I'm interested in how you manage your stress at work, at home, your relationships with others. I'm interested in where your body feels the trauma or any of the pain that you might have, because it all of that is like it's speaking, right? It is telling us that there's a problem here and we can't ignore any of it, and they're all connected. So in my office, if you come in and you choose to meet with me in my office and you meet all the criteria, I am going to actually refer you to a prescriber. And currently I use Skylight Psychedelics, and you will call them, you'll set up an appointment. I am not a prescriber. So you will meet with them. They are MDs. They're going to clear you medically. They're going to issue you a prescription for ketamine. You're going to get that delivered to your house. You are going to bring it into my office. If Skylight tells me that you've been given a prescription, if you don't show up with that medication, I need to call Skylight Psychedelics and report that. So you're going to bring it into my office. You are going to administer it yourself. I am not a nurse. Prior to coming into my office, you're to check your blood pressure. I give you all kinds of ways to prep yourself for the best experience. But medically, that's all of that's off the table. I don't touch the medicine. You put it in your mouth. I am there to just fully support you and guide you and do all of the work outside of anything medical. So the ideal protocol, and the way I have it set up, ideally. Now, we all have lives, we all have schedules, but if we could have a perfect world, you would be doing 6 to 10 sessions over the course of 3 to 4 weeks. And then oftentimes it really does depend. Some people want boosters, and we could do that once a week, then once every 2 weeks. It also depends on Skylight Psychedelics, or if you have another prescriber, what they believe you need. So we work as a team. I do not get a say over like giving you more medicine, although I may encourage or tell you either I don't think you need any more, or I agree. I do think like if we could get some more, it would be really beneficial because everybody's different. Again, that's just ideally, um, and it's also dependent on the prescriber's outlook on how much ketamine to give over how long. Um, so after your dosing day experience, I encourage you to just chill. Don't do anything. Anything other than being internal, journaling if you can, resting, and really bringing awareness to how you feel. What changes are there? Maybe if every night you have a glass of wine, notice, "Ah, I don't even want that." Or maybe let's say you normally stay really introverted and all of a sudden you have some energy to you. Just notice all of that. Do whatever your body is calling you to, but you may not drive. You cannot drive home from your session. I tell everybody like no driving for 12 hours. Generally, people don't. They go home for the night and then you can wake up the next day and you'll be just fine. Um, so making sure that you have your transportation ahead of time is great. Um, I would not encourage you to talk about your experience with anybody, especially your driver. You're still under the influence. I have a letter that you can give to anyone in your family that it kind of explains why I don't want them asking you a bunch of questions. You're just not really ready for that. Um, but I'm also happy to talk with your driver, or anyone is welcome to come and learn more about it. And it's not a punishment to them. It's just not a good time to really talk. You're going to avoid signing any legal documents, making any big life decisions. Don't try to go back to work or school. And again, rest. So if you have any other questions about psychedelic assisted therapy, ketamine assisted therapy, anything whatsoever, or just mental wellness coaching in general, reach out, schedule a consult call with me. I am more than happy to meet with you, get to know your story, and help you along your journey. Thank you so much for listening.